As the body ages, significant hormonal changes occur that alter how fat is stored, how muscle is maintained, and how efficiently calories are burned. These shifts are among the most powerful yet subtle drivers of age-related changes in body composition, especially the accumulation of abdominal fat and the reduction in lean body mass. While lifestyle factors like diet and exercise remain crucial, even consistent habits may not yield the same results in later decades due to these hormonal influences. Understanding the metabolic consequences of changing hormone levels, particularly estrogen, testosterone, and growth hormone, can help explain the physical transformations many people experience as they grow older and provide a roadmap for mitigating their effects. One of the most dramatic hormonal changes occurs in women during menopause. As estrogen levels fall, the body undergoes a shift in fat storage patterns from the hips and thighs, gynoid fat distribution, to the abdomen, android fat distribution. This transition is not simply cosmetic. Increased visceral fat around the midsection raises the risk for cardiovascular disease, insulin resistance, type 2 diabetes, and certain cancers. Estrogen plays a role in regulating glucose metabolism, inflammation, and fat oxidation. Its decline disrupts these processes, leading to a slower metabolism, greater fat retention, and reduced sensitivity to insulin. Even women who maintain the same body weight may notice increased waist circumference or a change in how and where fat accumulates. Men experience a more gradual but still impactful decline in testosterone levels starting in their 30s and continuing into older age. Testosterone is not only responsible for reproductive health and libido, it also helps regulate muscle mass, fat distribution, and overall metabolic rate. Low testosterone is associated with reduced lean body mass, increased fat mass, especially visceral fat, lower energy, and decreased motivation to exercise, creating a negative feedback loop. As muscle mass declines, resting metabolic rate drops, making fat gain easier even when calorie intake stays the same. Some men may also experience symptoms like fatigue, depression, and reduced physical performance, further compounding the effects of aging. Growth hormone and its downstream mediator, insulin-like growth factor 1, IGF-1, also declines steadily with age in both men and women. These hormones play key roles in cell regeneration, muscle repair, and fat metabolism. Their reduction contributes to decreased protein synthesis, slower recovery from injury, and impaired muscle maintenance. Lower growth hormone levels are linked with increased abdominal fat, reduced skin elasticity, and diminished aerobic capacity. While some therapies aim to replace these hormones artificially, such approaches remain controversial and come with risks, making lifestyle-based strategies a more sustainable path for most people. The cumulative effect of these hormonal changes is a body that stores fat more readily, builds muscle more slowly, and struggles to maintain the metabolic efficiency of youth. Left unaddressed, these changes can gradually increase the risk of metabolic syndrome, sarcopenic obesity, chronic inflammation, and reduced functional independence. But with awareness and adaptation, the effects can be softened, if not fully reversed. There are safe and effective ways to counteract hormone-related body composition changes without resorting to hormone replacement therapy. Resistance training remains the most potent stimulus for preserving or rebuilding lean muscle mass in both sexes, and its benefits extend beyond the gym. It helps regulate insulin, reduce abdominal fat, and improve mood and cognitive health. Combining resistance training with aerobic exercise can further enhance fat metabolism and cardiovascular function. Nutrition is equally critical. Diets higher in protein, especially when spread across the day, support muscle retention and combat anabolic resistance. Healthy fats from nuts, seeds, fish, and olive oil provide building blocks for hormone production and help regulate satiety. Reducing processed carbohydrates and added sugars can lessen insulin resistance, which often worsens with hormone decline. In addition, sleep and stress management become increasingly important as hormonal rhythms grow more fragile. Chronic stress elevates cortisol, a hormone that encourages abdominal fat storage and muscle breakdown. Poor sleep disrupts hunger-regulating hormones like leptin and ghrelin, increases cravings, and worsens glucose tolerance. Practices like mindfulness, deep breathing, and consistent sleep routines can help re-regulate hormonal balance naturally. Importantly, while these hormonal shifts are a normal part of aging, they affect each individual differently. Genetics, lifestyle history, medical conditions, and medication use all influence how the body responds to hormone decline. Some people may benefit from medical evaluation if symptoms are severe, particularly in cases of early menopause or clinically significant testosterone deficiency. However, most people can make meaningful improvements with non-pharmacological approaches. The transition through midlife and beyond brings undeniable changes, but it doesn't need to be a surrender to metabolic decline or expanding waistlines. By understanding the hormonal forces at work and responding with tailored exercise, nutrition, and lifestyle habits, individuals can regain control of their body composition, energy, and health. The message is not one of inevitability, but of opportunity. Aging may alter the hormonal landscape, but the terrain is still navigable with knowledge, discipline, and intention.